Good morning. So today I will provide a brief update, including comments on COVID-19 in PEI and Canada, self-isolation, masks, and planning for the COVID-19 vaccine program. There is one new case of COVID-19 to report in PEI today. The individual is a woman in her 20s and is a close contact of a case announced on November the 6th. So in total, there are 3 active cases in the province. All 3 cases are self-isolating with mild symptoms. The 3 cases are followed daily by public health, and contact tracing is complete. Since the pandemic started, there have been 67 cases of COVID-19 in PEI, all related to travel. Although PEI has not experienced the second wave of COVID-19, we are witnessing the devastating impact of this virus in other provinces and around the world. The United States recorded a new daily record on the weekend. That country has reported over 10 million cases and almost 250,000 deaths due to COVID-19. It appears as if the U.S. is experiencing a distinct third surge in cases with little relief between the 3 surges. The situation in Canada continues to escalate, with almost 25,000 new cases in the past week, a 15% increase from the previous week. This represents an average of over 3,500 new cases a day. And in the past 24 hours in Canada, there were 4,086 new cases reported. And just to compare, the peak in the first wave occurred in April with only 2,038 new cases in a single day. So as forecasted, the second wave of this virus is proving to be worse than the first wave. British Columbia increased cases again by 35% during the past week, Manitoba by 27%, and Saskatchewan by 25%. These increases are in addition to significant increases in the previous weeks. New Brunswick currently has 21 active cases, and Nova Scotia has 16 active cases. Outbreaks are associated in this country with a variety of settings, including long-term care and assisted living, congregate living situations, as well as schools and childcare settings. Transmission of COVID-19 in personal gatherings is also concerning. We are learning that individuals are more likely to let their guard down and not maintain physical distancing and hand hygiene in more relaxed settings. Many provinces are once again having to restrict activities to contain COVID-19. For example, British Columbia has instituted travel and gathering restrictions in some areas of the province for at least the next 2 weeks. Social interactions are limited to households only, limitations on indoor sports, essential travel only, and workplaces and businesses are to ensure that physical distancing is maintained. We are fortunate in PEI that to date we have not had a surge in cases. And while I am grateful for every day that we remain in this new normal, I'm also worried about the impact of a second wave of COVID-19 in our province. And I don't believe it's a matter of if we experience a spike in cases, but rather a matter of when PEI is affected by a second wave. And I worry about the impact on islanders, especially those in vulnerable groups, and our healthcare system. Thank you to everyone who is following public health measures. Your efforts are working. And collectively, all the individual actions contribute to keeping islanders safe. Now is not the time to be complacent and put yourself and others at risk. I urge islanders to continue to follow the public health measures and take steps to protect themselves and others. We are in this together for the long term. Let's continue to do what islanders do best and look out for one another. Given the rising incidence of COVID-19 in Canada and around the world, I urge islanders who travel outside the Atlantic bubble to be extremely cautious. Individuals should follow the public health measures in place in the jurisdiction they are visiting. Now is the time for everyone to assume the person next to them in a public setting may have COVID-19. And individuals who travel to PEI from outside the Atlantic bubble are legally required to self-isolate for 14 days. Some individuals can apply to our office to work isolate. Since the early days of the pandemic, PEI has had rules around self-isolation, including daily check-in calls with people required to isolate. Self-isolation means staying at home and limiting contact with others. You need to stay on your property, for instance, and leave only to seek medical care. Grocery and other essential items should be dropped off at the door. In PEI, it is possible to self-isolate in a home with other people, provided you have limited contact with others and have a separate room and bathroom if possible, and all common surfaces should be disinfected regularly. The science regarding the impact of masks on the transmission of COVID-19 has accelerated during the course of this pandemic. We know that well-designed and well-fitting masks or face coverings can prevent the spread of infectious respiratory droplets. But masks are not the first line of defense against COVID-19. They provide an additional layer of protection. Masks do not replace other important public health measures such as physical distancing, staying home when not feeling well, and hand and surface and respiratory hygiene. How well a face covering or mask works depends on the material that is used, how it's made, and how well it fits. Masks should be large enough to completely cover the nose, mouth, and chin without gaping. Masks should allow for easy breathing and should be changed when they become damp or soiled. Reusable masks should be washed daily. Similar to the World Health Organization, Dr. Theresa Tam of the Public Health Agency of Canada recently recommended that masks be made of 3 layers, with the 3rd layer being a filter that can be changed or washed regularly. She also advised that people should not discard their 2-layer masks, but rather going forward, people should purchase 3-layer masks. Our office continues to highly recommend that masks be worn when enclosed indoor spaces when physical distancing cannot be maintained. I want to clarify that spit guards are not a replacement for masks. With Remembrance Day tomorrow, just want to emphasize that choirs should wear masks and maintain a physical distance of 6 feet. This pandemic, I know, will not be over for a while, but we have good news announced yesterday, and certainly work underway about a safe and accessible vaccine. The Government of Canada has signed contracts with several COVID vaccine manufacturers that are in various stages of testing in clinical trials. The clinical trial data will be submitted to Health Canada for critical evaluation of the safety and efficacy. And only vaccines that undergo the rigorous assessment and approval by Health Canada can be offered in Canada. In the beginning, there will be a very limited supply of vaccine available. It will take many months for the vaccine manufacturers to make enough doses of vaccine to offer everyone the opportunity to be immunized against COVID. That is why the vaccine will be rolled out in phases to key populations. Eventually, everyone who chooses will have the chance to be immunized with the approved vaccine. We are already working hard on the logistics of the PEI COVID vaccine program, along with our partners in the federal government. If approved by Health Canada, the first doses of vaccine could arrive in PEI in early 2021. When available, the vaccine will be offered free of charge to Islanders. And I'll continue to keep Islanders updated as more information is available and the distribution plan for priority groups is finalized. The prospect of a vaccine gives us much hope and is really a beacon of light for us all. It's exciting to know that we could start administering vaccine to some Islanders in the new year. And many other elements of our response do give us reason for hope and optimism in the midst of this global pandemic. We have our island children and teachers who've just entered their 3rd month of school. We have children and adults who can play organized sports. Rinks across PEI are operating and spectators are allowed. We can enjoy a meal in a restaurant. Islanders can have faith gatherings regularly. We can visit and socialize with our loved ones in long-term care facilities. We can access needed medical, dental, and social services. And we can travel freely within Atlantic Canada with no need to self-isolate. As we recommit to protecting ourselves and others, please be patient and please be kind. Thank you.
Thank you, Dr. Morrison. Good morning, everyone. The Health System Joint Response Team continues to be in an active monitoring and planning level. And as you all know, testing continues to be important to the COVID response, and our testing clinics and laboratories remain very busy maintaining the testing levels needed to protect Islanders. For Remembrance Day tomorrow, the clinics in Montague and O'Leary will be closed for the day, but the Summerside and Charlottetown drop-in clinics will remain open and available. Yesterday, we tested 330 people across the province. We also saw 15 people at our cough and fever clinics. As a reminder, people who have cold and flu-like illnesses who might otherwise have visited a doctor's or nurse practitioner office or emergency department are asked to instead make an appointment at one of our cough and fever clinics in Charlottetown or Summerside. Your doctor or nurse practitioner or 811 can refer you directly to the cough and fever clinics in those locations. For all other non-urgent or emergent issues, your family doctor or nurse practitioner offices are now open for both in-person and virtual care and are seeing patients. We continue to refine and update our visitor protocols and processes as the pandemic continues, and as Dr. Morrison mentioned, the evidence and the guidance changes. We appreciate all visitors continuing to follow the protocols and guidance at all of our healthcare facilities as well as our long-term care homes closely, including wearing the personal protective equipment and following any restrictions indicated by staff. We're grateful to everyone for their cooperation with the public health guidance and measures, which has allowed us to continue to be able to offer many regular health services. Thank you to all Islanders for continuing to follow these public health measures. Please continue to seek care when you need it and bring and wear your mask. Thank you.
Thank you, Marion, and we'll open it up for questions.
Steve Bruce, CBC.
Yes, good morning to you both. Question for Dr. Morrison. Can you provide some more details on the 3 active cases we have now? I know you announced last week that one man traveled from Montreal on November 1st. So what about the others? Where did they come from? How did they get here? Did they all self-isolate upon arrival? And did they have many close contacts?
The 2 cases that were announced on the weekend, one, as you mentioned, did travel by air, and the other one was by vehicle into the province. They self-isolated, and as I mentioned earlier on, the 3rd case is a close contact that was self-isolating with one of the initial cases, or one of the cases from the weekend, and very limited close contacts of anybody else, and they've all been tested, and one remains in isolation.
And you mentioned you're working out the logistics now of getting a vaccine to Islanders when it does become available. Can you talk about what those logistics are that need to be worked out around this, and I guess how it will be decided who gets the vaccine first?
Hi, Steve. So a couple of things. One, the logistics are everything about how vaccine may be transported here to the province. One of the vaccines that may be approved early on in 2021 by Health Canada has to be stored at a very cold temperature at minus 75 degrees. So making sure there are freezers and shipping that can be done with those particularly cold temperatures. So that would be one example of the logistics, but lots of really good discussions that are underway with our federal colleagues, but also even here within the province. And in terms of the priority populations, and these have been identified really nationally and have been some of the initial priority groups have been identified by the National Advisory Committee on Immunization and the NACI, and they would involve groups, for instance, such as frontline healthcare workers who may be working with people with COVID, vulnerable populations, so those who may be 70 years of age and older, essential workers, and those who live and work in conditions that put them at increased risk of COVID-19. Now, as we mentioned, when the vaccine comes, it has to be approved by Health Canada, and even within the priority groups, there will not be enough vaccine right away for all vaccine groups. And some vaccines that are approved may be indicated more for certain groups than others. So still lots of work, and we'll be keeping everyone updated in the weeks and months ahead. But I think really I'm so pleased that we're in a position to talk about vaccine arriving in this province. And I think it's earlier than I would have anticipated, maybe being able to do. If you'd asked me in April, I wouldn't have predicted that we would have vaccine available in early 2021.
Great. Thanks so much.
Stephanie Kelly, CBC.
Good morning. I have a question for Dr. Morrison. Yesterday, we learned that anyone coming to Nova Scotia from outside the Atlantic bubble must self-isolate for 14 days alone, or every person living with them has to isolate as well. Just wondering what your reaction is to that news, and if or when it's something that would ever be considered for PEI.
Well, we actually have been doing quite a bit of that now, because we in this province have people have to submit their isolation plan prior to arrival, which is a little different than in Nova Scotia. We usually have a chance to make sure that people truly can isolate, either collectively as a family and they isolate, or that they're isolating individually. So all the way along in the last number of months, if people are unable to isolate in their own apartment or own house, we've been able to offer them some accommodation elsewhere, either if you're a case or if you're a close contact. So we'll continue to emphasize the importance of self-isolation and what that means. There are certain houses that are set up very with a sort of, whether it's an in-law suite or something quite separate, and that certainly can accommodate self-isolation, but having a large number of people in one particular apartment, for instance, really cannot self-isolate together in that setting. So we'll continue to look at that, but we've been paying quite a bit of attention to it, and I think continuing to emphasize why self-isolation is really important, and I think Nova Scotia has really highlighted that in the last day.
Just a quick question following that, just about gatherings. Charlottetown Police laid a charge over the weekend for a personal gathering of more than 20 people. So they say there was about 30 there, so just 10 over what would be considered allowed, I guess. Just wondering what you think in terms of enforcement, what kind of message that sends, especially as we're heading into the holiday season and normally people would be preparing for large gatherings.
Talked about it here at different times, the importance of trying to keep our gatherings small, especially as we go into the holidays and think about them differently. The personal gathering limit is 20, and more than that, you'd need to have an operational plan in place, and certainly any more than 50, you'd have to have an operational plan approved by the office. And remembering that even within the gatherings, physical distancing and some of those other public health measures are very important. I think, the enforcement happens when they get a call or a complaint or a concern, and I think it's just a reminder from my perspective of the importance of these public health measures. We know there are outbreaks related to personal gatherings, and it can spread easily.
Thank you very much.
Welcome.
Gabrielle Dumont, Radio-Canada.
Bonjour, bienvenue. Mes questions, c'est par rapport à la mise en garde de la population par rapport à la pandémie. Docteur Morrison, vous avez mentionné tout à l'heure là cette annonce qui a été faite par l'entreprise de Pfizer et par son partenaire allemand qui ont annoncé ce vaccin contre la COVID-19. Est-ce que vous pensez que cette annonce du vaccin, ça va changer la façon comment vous faites votre communication auprès de la population, justement pour éviter que les insulaires baissent leur garde par rapport aux mesures de sécurité?
À ce moment, s'il y a un vaccin et puis on peut vacciner tous les groupes qui sont plus à risque des complications de COVID-19, ça va peut-être changer les mesures pour la population générale, mais à ce moment, on n'est pas prêt à annoncer les changements pour la population, mais c'est tellement important qu'on continue à aviser les gens à propos des mesures de santé publique parce qu'on veut on veut arriver à un moment pour donner un vaccin sans que il y a un gros impact de COVID-19 ici qu'on voit ailleurs au pays.
Mm-hmm. Et ma deuxième question, c'est juste pour faire un suivi à ce sujet-là, parce qu'on a quand même une bonne nouvelle par rapport à cette annonce du vaccin. Et on a très peu de cas ici à l'île du Prince-Édouard. On est quand même très chanceux. Mais ça fait quand même un mois qu'on a l'application Alerte COVID qui est disponible dans notre province. Est-ce que vous pensez qu'avec ces bonnes nouvelles-là, avec le fait qu'il y a très peu de cas à l'île, est-ce que les gens seront désormais moins portés à télécharger cette application? Est-ce que les gens ne vont pas prendre cette application sérieuse?
Je sais qu'il n'y en a pas eu, on est chanceux et c'est vraiment à cause du grand travail des insulaires ici d'avoir pas beaucoup de cas. Mais je pense que les insulaires vont prendre ça assez sérieux parce qu'on voit qu'est-ce qui arrive partout au monde, partout au Canada avec le COVID-19. Alors, je pense que les insulaires veulent, depuis les mois, ils ont fait déjà et puis ils vont continuer. Et j'espère de garder ces mesures en place pour qu'on peut tout prendre soin les uns les autres jusqu'au moment qu'on peut retourner plus normal, si vous voulez.
OK, parfait. Merci beaucoup.
Merci.
Stu Meepy, The Guardian.
Hi, good afternoon to you both. I suppose this is a question that could be answered by either Dr. Morrison or Ms. Dowling. Really, I'm wondering if you think that Islanders have, now that we're in our Atlantic bubble, have become, I guess, complacent about the risks that are associated with the second wave. I mean, the case count remains low. There's still no hospitalizations. I mean, you can control what happens within the health system to a degree, but culturally, do you think that Islanders are really ready for the risks of this second wave right now?
I'll probably hi, Stu. I am a little worried that we don't become complacent, and I think we've tried to highlight that by talking about what's going on outside the Atlantic bubble. And this is not the time to become complacent. We've worked so hard for so many months to try to minimize the impact of COVID-19 in this province and in the Atlantic bubble, and especially as we're going into holiday season. And we talk about sort of recommitting to looking after each other, and it's really a recommitment to these public health measures. And once it's a really good thing to know that there's vaccine potential in the new year. because we should just keep working together and to that point where we can protect more people in this province. And but I do worry that we will be sitting here a month from now and it will look a lot different than it does now. And so that is what certainly concerns me, concerns the team that I work with every day, because it is all around us and it's knocking on our door. And so everything we can all do together to try to minimize the cases here and the impact is going to be really key in these following weeks.
Okay, and I guess just one follow on that. I guess last week the Public Health Agency of Canada updated its guidance about COVID-19 transmission, specifically noting the risk of transmission via aerosols. I guess the implication of this for public health is that ventilation is now considered, I guess, to be more important to minimize possible spread. So I'm wondering if public health officials have actually done any kind of audit of ventilation within buildings where people tend to gather, like schools, community centers, or even government offices.
So, Stu, it's a good question. And we, as you point out, the Public Health Agency talking about the aerosolizing of some particles of this virus. So we know that this virus is mainly large droplets, and the majority of them will drop to the surface quite quickly, and either on the surface or if you cough, speak loudly, sneeze. But then there are some smaller particles that may remain aerosolized for a longer period of time. And that's when we talk about these layers of protection, and that's why Dr. Tam has talked about the 3-layer mask. We talk about the physical distancing being important. We talk about certainly being outside where possible, and but ventilation being one more aspect of that. So it's the multitude of layers that's really key. They've talked about, opening a window where you can, making sure that there is some fresh air, but our office certainly has not done specific ventilation audits, but it's part of the messaging that I think is really important as we go into a season where we will be indoors, certainly more than we were over the summer.
Great, thank you.
Julien Lecacheur, Radio-Canada.
Bonjour, Dr. Morrison. Dr. Morrison, je voudrais revenir sur le fait que l'Association des aéroports du Canada en Atlantique demande au gouvernement des 4 provinces de tester systématiquement les voyageurs à leur arrivée pour dépister la COVID-19. Ils demandent notamment ça parce que l'achalandage dans les aéroports a vraiment chuté. On parle de plus de 90% de diminution. Est-ce que vous répondez favorablement à cette demande de l'Association des aéroports du Canada? Pensez-vous que la province devrait mettre en place des tests de dépistage automatiques à l'aéroport de Charlottetown, ce qui permettrait plus de trafic?
C'est quelque chose qu'on va discuter avec mes collègues ici en région Atlantique, même cet après-midi. Mais à ce moment, un test automatique à l'aéroport, ça ne va pas changer la période de quarantine ou auto-isolement qu'il faut en faire. Et, parce qu'on sait depuis, avec la science et l'évidence, que si on est négatif un jour, vous pouvez être positif la journée qui suit. Alors, et on a aussi les tests à ce moment donnent des résultats résultats des fois qui sont des fausses négatives. Et alors, ça m'inquiète un peu à propos de ça aussi. Alors, à ce moment, ça ne va pas changer la période et la nécessité d'auto-isoler. Mais un jour, j'aimerais qu'on ne doit pas en faire, mais à ce moment, je ne pense pas que ça va changer ce qu'on on dit d'en faire, qui puisse vraiment, c'est légal à ce moment de auto-isoler pendant les 14 jours. Mais on va continuer d'en regarder. Mais j'imagine que les premiers ministres ici à région Atlantique vont répondre ensemble à cette lettre.
Parfait. Merci beaucoup, Dr. Morrison.
Laurent Rigaud, La Voix acadienne.
Bonjour, Dr. Morrison. J'ai une question au sujet du vaccin. Est-ce que vous pouvez répéter en français ce que vous avez expliqué en anglais? Est-ce qu'aujourd'hui, on est sûr qu'il y aura un vaccin début 2021 ou qu'est-ce qu'il faut encore attendre pour vraiment être certain que ça va venir?
Bonjour Laurent. On doit avoir le Health Canada, Santé Canada, de s'assurer que c'est un vaccin qu'il veut distribuer au Canada. Alors, mais on pense à ce moment que c'est possible. Si Santé Canada dit oui, on regarde toute l'évidence et c'est un bon vaccin pour les Canadiens, ça va être distribué dans des quantité limitée à chaque province et territoire. Et puis, on va commencer à recevoir si tout va bien. Et puis, Santé Canada a dit oui, on peut en avoir. Et alors, et puis, si tout va bien, on pense avoir un peu de vaccin dans les premiers mois de 2021.
D'accord, merci. Et j'avais juste une question sur la situation au Canada. Vous avez dit qu'il y a vraiment beaucoup plus de cas aujourd'hui que lors de la première vague. Je suppose qu'on teste aussi beaucoup plus. Donc, quelle est la gravité de cette deuxième vague? Est-ce qu'il y a plus de gens à l'hôpital aussi?
C'est une bonne question. Alors, j'ai dit en anglais qu'on voit bien plus de personnes, de cas. En avril, on avait maximum 2000 cas dans une journée. Puis maintenant, il y en a pendant les 24 heures qui passent, c'est plus de 4000. Alors, on voit plus de cas. Et puis, on commence à voir aussi une augmentation dans cette vague des personnes à l'hôpital. Et ça commence à changer. Je pense que c'est la semaine passée, on a vu les personnes à l'hôpital, ça augmente par, je pense, 11%. Alors, mais on a appris beaucoup de choses à propos de la première vague. On essaie de garder les long-term care homes plus en sécurité, mais on en voit maintenant les cas dans ces facilités aussi. Alors oui, on voit plus de cas et on voit maintenant ça commence à avoir plus de personnes qui meurent et qui sont à l'hôpital.
Merci beaucoup.
Merci. That's it. Thank you very much.